items to go to government. And we know that the president was in the area today. Let's cross back to Griselda.
Yes, thank you, Francis. As we continue our coverage of the flood-ravaged areas, now the KwaZulu-Natal Health Department has urged relatives of the flood victims to go to government mortuaries to identify bodies. The bodies of 36 people are being kept at the Pinetown mortuary. These are bodies that were retrieved in Chatsworth, Malvern, Mariannhill and surrounding areas. A further 15 bodies are at the Magwaza Maphalala Mortuary, formerly known as Gale Street, and are from Umlazi, Reservoir Hills, Overport, Bluff and surrounding areas. We're joined now by the KZN Health MEC, Dr. Sibongiseni Dhlomo from our Durban studios. MEC, thanks for your time this evening. Obviously, the most devastating impact of these floods seems to be from KwaZulu-Natal. Paint a picture for us about what the situation in the mortuaries is like now.
Thank you very much, ma'am, and good evening to all the viewers. Yes, it is quite devastating. We've just been checking our readiness, our state of readiness to do the postmortems. Just to make a correction, the numbers have since increased. At the Pinetown mortuary, we have now 40 bodies. Fortunately, some of the relatives, friends have come in to identify 34 of those bodies, and we have managed to do 6 postmortems today. There's a program to do the balance, or at least another 15 tomorrow, so that by close to the weekend we would be completed. Yes, in Magwaza Maphalala Mortuary in Gale Street we have 15 bodies. Only 2 of those have been identified positively by relatives and friends. We are really pleading and requesting that if relatives, friends can come in to identify the balance of those bodies, because it makes it easy for our staff members to conduct postmortems.
MEC, you've just mentioned that in Pinetown the number has actually gone up. So there's definitely a prospect of finding more bodies under the rubble, and as cleanup operations get underway in areas where the rain may somewhat have subsided, what other means of communication are you using to connect with these families? Because in some of these areas you have telephone lines that are down and a means of communication that is hampered at this stage.
You are correct, ma'am. The correct statistics that we get updated from are compiled by our sister department, COCTA, and as of this afternoon, the number is now at 60. So probably I'm reporting as of 5:30 figures that came to our mortuaries. That is 40 plus 15, so it's about 55 that I'm reporting on. So the other 5 that are already there, I have not been able to say which mortuaries they've gone to. Yes, we rely very strongly on the councillors to actually, wherever there's a digging and bodies are being identified, the councillors are of a great resource to actually mobilize and get communities to come forward and assist, because we can actually tell. Of course, it is difficult because some of the people might have been washed from up the stream and are found in another area, in another ward. But councillors are of great resource in helping us to identify and trace relatives.
So I think if there's anyone who's watching at home and cannot locate their loved ones at this stage, and they fear that they may have been a victim of this devastation, what can they do? Who can they contact?
We would request that the assistance of councillors could come in very handy. But as we are correctly saying, if anybody is watching or listening to our discussion and they have not seen their relative, friend or a member of the family, please can they come and assist us at 2 of these mortuaries, largely Gale Street, where we have not really had a significant number of those who are coming to identify, and those are areas affected. This is Bluff, Reservoir Hills, Umlazi, and the areas mainly in the south. And so we really plead. We have made significant progress in and around Pinetown, but again, there are still 8 bodies have not been identified. So anybody who actually has got this message, please, they can walk into our mortuaries. There will be a team there of psychosocial social workers, every support of councillors and pastors to assist them, and then we'll take them through the viewing for those bodies that they might think that are their relatives.
MEC, at this stage, as the water obviously, has spread to quite a number of areas, and obviously people are still trying to clean up. As the health department, have you sent out some inspectors to also make sure that, there is no risk of disease if you have children who would otherwise be playing in some of, the areas that have been flooded around KwaZulu-Natal? Just very quickly.
The disaster team managed by COTA has got all those skilled people to work around. It's all coordinated at one center by the disaster team. Of course, we have to have our environmental health practitioners on the ground. We also are very clear, because some of the pipes have burst, and we are correct. It may as well be sewage now spilling into water. So yes, we'll be on a very close up watch out for issues like those, because in such a devastation you might really find an outbreak of waterborne disease, and therefore we are at an alert. Of course, our health experts are also part of the collective team that is really doing this mop-up on this disaster program.
The KwaZulu-Natal Health MEC, Dr. Sibongiseni Dhlomo, thank you very much for your time this evening, saying that 55 bodies are now at different mortuaries in KwaZulu-Natal, urging families to go out and try to identify their loved ones. They're working around the clock to ensure that as much communication gets out to those who may have been affected.